Dear students, in today's lecture, we are going to study adrenergic neuron blocking agents. The learning outcomes for these topics are: after completion of this topic, students, you will be able to understand the mechanism of action of guanethidine monosulfate, metabolism of guanethidine monosulfate, side effects of guanethidine monosulfate, uses of guanethidine monosulfate. Guanethidine monosulfate. The structure for the same is as the guanethidine monosulfate. It is a 2-hexahydro-1,2-H azocyanyl ethyl guanidine sulfate. It is a white crystalline material that is very soluble in water. There is an absence of CNS effect such as depression because the drug is highly polar and does not easily cross the blood-brain barrier. Guanethidine monosulfate produces a gradual, prolonged fall in the blood pressure. Usually 2 to 7 days of therapy are required before the peak effect is reached, and usually this peak effect is maintained for 3 to 4 days. Then, if the drug is discontinued, the blood pressure returns to the pre-treatment level over a period of 1 to 3 weeks. Because of this slow onset and prolonged duration of action, only a single daily dose is needed. Next, mechanism of action for this drug. It blocks the adrenergic transmission by blockade of release of noradrenaline, blockade of reuptake of noradrenaline, depletion of noradrenaline, stores at sympathetic nerves ending and tissues. Metabolism of guanethidine monosulfate. Guanethidine monosulfate is metabolized by microbial enzyme 2,2,6-carboxy-hexylamino ethyl guanidine and guanethidine N-oxide. Both metabolites have very weak antihypertensive properties. Guanethidine monosulfate is taken up by the amino pump located on the neuronal membrane and retained in the nerve, displacing norepinephrine from its storage site in the neuronal granules. The displaced norepinephrine is metabolized to homovanillic acid by mitochondrial MAO, depleting the nerve ending of the neurotransmitter. The usefulness of guanethidine monosulfate also resides in the fact that once it is taken up by the nerves, it produces a sympathetic blockade by inhibiting the release of norepinephrine that would occur on neuronal membrane responses to stimulation by the nerve action potential. Guanethidine monosulfate stored in the granules is released by the nerve action potential but has very low intrinsic activity for the adrenergic receptor on the post-junctional membrane. Moderate doses for the prolonged period or a large doses may produce undesirable side effects by causing neuromuscular blockade and adrenergic nerve conduction blockade. Side effects for the drugs are diarrhea, hypertension. And uses of this drug is it is used in a treatment of chronic pain. Thank you.